All right, so how can we make sense of AI in healthcare and also the swath of new copyright lawsuits against AI technology companies like OpenAI, ChatGPT? That's why my guest this week is Sheena Franklin. She is an entrepreneur and speaker at the intersection of healthcare policy and technology. Sheena founded Kept Health, a Techstars company which provides a diagnostic clinical decision support system with a focus on dermatology. I am so excited for this conversation, but first, welcome to this week's episode of Make Sense, a video podcast that simplifies complex issues at the intersection of tech and people. There are so many of them. So whether you're totally hyped on artificial intelligence and you're ready for the robot takeover, or you want to crawl into a cave after deleting all of your social media accounts, I get you. I'm here with my guests to help make sense of what's going on so you can design yourself into the future. My name is Lindsay. I'm a product market fit strategist, innovation consultant, and venture fundraising advisor. If you're new here, subscribe on YouTube or wherever you get your podcasts. All right, Sheena, let's make sense of artificial intelligence in the doctor's office and other super important healthcare technology trends. How are you?
I'm fine, Lindsay. How are you? Thanks for inviting me.
So excited. I saw you post on LinkedIn. I mean, I see all your stuff, and I wanted to talk about what you learned at Digital Health Startup Day, hosted by the Consumer Technology Association. For those of you that are unfamiliar with Consumer Technology Association, they are behind the Consumer Electronics Show, which is usually at the beginning of January in Las Vegas every
Mhm.
year. Is that right?
Yep.
Cool. Yeah. There were three big takeaways, and I'm hoping we can discuss them today. But we have to start with Make Sense signature kickoff segment. Crystal ball. What
Okay.
does the future hold?
I'm
So this is
ready.
where I call out interesting predictions for this year, and the experts, my guests, they tell us their hot take. So I'm going to shoot you some headlines, and Sheena, I want you to say, yes, I want that to happen, or no, please no. And if you know more, we'd love for you to share. So,
Okay.
we can't talk healthcare without talking about the worker shortage. So, to solve the healthcare worker shortage, hospitals are turning to technology. So, hospitals, tech firms, and government agencies are going to band together. Virtual care, remote monitoring, hospitals at home, and a need for a lot more training. What do you know?
Yes, I believe that will happen. And here's why. Two key points, some of which you touched upon. The first is training, because we do have a shortage of doctors. And we'll be able to help that if we change or revamp the way doctors are educated and also how residency programs are run. So there are actually more doctors who graduate medical school who don't get matched into a residency
I had
program,
no idea. Wow.
right? And then second, AI will help with the shortage of care that's readily available, right? And it will be done through more of triage tools. So then you have individuals who are treated virtually, and then some will go directly to in-person clinic for care because they're more serious patients.
Cool. I had no idea that there were more doctors that graduated than places in residency.
Yeah, and so this is how I found out. One, from our chief medical officer, and two, my cousin just graduated medical school. And so I found out so much about how doctors are selected and where they go and who gets a residency program and who doesn't.
Yeah. Well, I know, I have a cousin who's been in the field for a long time, and he couldn't get into a school in the US. So he actually went to Italy for his medical training
Yeah,
before coming back to the US. So
yeah.
that's really
It's
interesting.
very interesting.
Yeah. Wow. And with the diagnostics, is that something that Kept Health is helping with?
That's exactly what we're doing, right? So we're building out our data set, training our algorithms for our AI so that we can then have a diagnostic tool that is being used on a telehealth platform. So if you're on your mobile app, but also if you're engaging with your physician and their clinic, a hospital system, or maybe even for us, our future vision is to have like kept health in your Walgreens, CVS, or maybe in even Sephora, right? So you're coming onto the platform and we're triaging your care. So anything that you would be considered like run of the mill or low severity, excuse me, would be treated on the mobile app. But anything that needs or requires in-person care, you're then getting transported, if you will, transferred to an in-person clinic. So now the physician is able to free up their schedule, so they're, you don't have to wait 3 or 6 months. You're able to get in more frequently because we lifted the burden from the patient and the physician.
Yeah, I don't know if this is like TMI for my own podcast, but I make the rules, so I'm going to go with it. When I was in college, I experienced psoriasis for the first time, and it was just on my left calf. And
Mm-hmm.
I remember being at the University of Virginia hospital, and them, it's a teaching hospital, so like eight, eight residents or eight medical students come in with the dermatologist, and they can't decide if it's psoriasis or eczema. And so now I have this cute little scar because they took a biopsy to figure out what it was. And it seems like 18, 19 years later, I'm dating myself, like that AI imaging should be able to help with that more like faster, right? You think so?
Yes, and that's exactly why we're doing kept health, right? It's about how are we better training these models, right? And so there's so much or open source data, which I think we're going to get to. But when it comes to dermatology, because it is a visual science, you have to be really precise and really good at what you're doing, right?
Mm-hmm.
Um, and then also, if you want to add like skin tone into that, then that makes the problem even worse, right?
Yeah,
So it's just compounded issue on compounded issue that we're trying to solve, that we will solve.
yeah, that's awesome. All right, so here's the next prediction. Speaking of remote monitoring and telehealth, healthcare will pull some invisibility tricks. So, ambient health monitoring will go beyond standard remote patient monitoring to continuously collect data via devices that are more connected and less invasive than ever. Do you know anything? You can hear my voice that I don't know much here.
Yeah, so it's all about collecting data, right? We always hear that data is powerful,
Gold,
but
right? Data is
right,
gold, right?
it definitely is. But it's because from the physician side or the digital health company side, right? That will enable us to keep making this product better, right? But then
Hmm.
people run afoul of like data collection or how
Hmm.
you collect it, how you de-identify the data. So I think it's needed and it's going to happen.
Yeah, I think also, um, a lot of people will say like you don't want to go into the hospital if you don't have to because sometimes you can get more sick. And if we can keep people out of the hospital, it not only helps address our problems with labor shortages, but also keeps people, from cohabitating with others that might have
Yeah,
other
yeah. Or
serious needs.
always going to the emergency room and then
Yeah.
overburdening the emergency room. Yeah,
Yeah.
absolutely.
Yeah, I talked about this in another Make Sense episode with Kat Hoffman, the founder of Q Spaces. We talked about the LGBTQ plus community having a lot of apprehension about whether they will get fair care from doctors. So often their first interaction for a specific medical issue is at the emergency room. So given like the unfortunate onslaught of laws that's making it worse situation for that community, having ambient health monitoring and remote patient monitoring can really help to get to escalate certain cases
Right.
before they go to the emergency room. Cool.
Exactly.
All right, two more. Femtech turns to menopause. So, more famous women are leading the menopause conversation. More startups are turning to underserved issues like menopause as women's health space continues to expand.
So this is a little bit touchy. So I will say yes, it will expand. Um, I'm not sure it will expand as quickly as I would like. And what I mean by that is femtech is more than menopause, right? Like femtech is more than just anything that has to deal with my reproductive organs. And so I'm really looking for, female founders in the space, female investors to really start, encompassing the broader perspective of what we face as women, right? Whether
Yeah.
that's dermatology, whether it's inclusive services. I believe you just said ambient, the startup you talked with before. Like those are women's health issues too, not
Right.
just if I give birth
Right,
or not birth.
exactly.
And
Or
I'm
if my hormones are messing with my energy levels, right? Yeah, I do want to share with the audience, unfortunately, that femtech just is not. And if I want to narrow the definition from what Sheena gave you, specifically, yeah, technology that is specific to women's health issues, hormones or not, babies or not, um, it's not getting at as much investment as we would like to see, given that we make up half the population, right? So we still a lot of work to do to convince the decision makers, the purse string holders, that like these issues are big enough to make venture backable businesses. So the more we kind of keep to ourselves with feminine health issues, the harder it is to change the minds of those people with the power to invest in female led and female focused technology companies. Uh, and, probably I know what I said also expands to just female led companies, not necessarily female focused companies. And it's a hard investment world out there. So let's help our entrepreneurs. All right, last one, dermatology focused. No tox tweakments. So non-invasive treatments such as LED facials and skin rejuvenations will help consumers replicate the effects of cosmetic procedures without the cost, the pain, or the downtime.
So yes, but I will also say like there is a difference between skincare, dermatology, medical dermatology, and cosmetic dermatology, right? I think
Okay.
what we're gonna see is it's gonna be a mixture, right? More proactively mixture. We already do that anyway, right? So if we have acne or any psoriasis, eczema, whatever, right? Like we first go to our Walgreens, and if that doesn't work, then we're going to the dermatologist, and then when they have something, they say, well, use this over-counter product, or maybe you should do this type of Botox treatment because it's going to help with this, right? So I think it's going to be a mixture. So it's going to be interesting to see what
Yeah.
happens.
Now, I had a founder, Devanshi Garg-Serene. She's the founder of Motif Skincare. She expressed some concern that consumers of no tox tweakments may be disappointed in their results, given that this is kind of like a over the counter DIY version of what people in the past or people with more money have been able to do with doctors and spas and estheticians. So do you have any concerns about the consumer being misled about what is possible? Yeah.
Yeah, so I guess, with those, I would just lump that into category of over the counter, right? So like there's going to be some level of understanding where we're using this product. It's not going to be as good as when we're at the doctor, right? So
Mhm.
I think it will be, it should, and it will be accepted as more of an aid, not necessarily a solution,
Mhm.
right? And I think the marketing from these companies, they will be smart enough to cover themselves so they don't want their customers coming back to them or on TikTok, Instagram, and saying this product doesn't work, right? Like they're gonna
Right.
say, you know, this is for at home results. It's not going to be the same as something you would receive from a professional.
When I think about this one, I think about the difference between an Invisalign for teeth straightening and Smile Direct. Smile Direct, you really are not seeing a dentist as your teeth move. They just send you these retainers, and it if you listen to the community of past users, including myself, you really should only do it for small little changes in
Mhm.
the direction of your teeth, not for massive rework. But there are plenty of people that have massive rework that don't want to spend the money, and they go with Smile Direct, and they end up having more problems than
Yeah.
when they started. So I think about which kinds of treatments should not go to the self serve. Uh, like
Yeah.
Botox, right? If you put it in the wrong place, you can have droopy eyebrows, right? So maybe you shouldn't be doing it yourself.
This is true, although people still do. But I think it just opens up it just opens up more opportunity. Well, selfishly, I will say it opens up more opportunity for cats because that's what we do, right?
Right.
Not only can you chat with a dermatologist for the virtual care, but you can chat with an esthetician, right?
Mm-hmm.
Before your appointment, or if you discover one of these new products, you can come on a platform and say, hey, will this work not just for the broader community, but is this going to work for me? And if
Yeah.
so, who do you suggest that I go to? And then from there, we refer you to someone, and then we, give you a plan to help manage your care before and after.
So if I go with the analogy with Smile Direct, Kept Health kind of becomes my dentist consultant, right?
Basically, yeah.
So Smile Direct's not giving me this service, and I don't want to go to a dentist to get Invisalign. So Kept Health kind of fills in that knowledge gap.
The knowledge gap, and then we
Yeah.
direct you to where you need to go.
Well, I love that. I mean, anyone listening, to make sense if you are contemplating any of these DIY non-invasive treatments. Kept Health is there to help you on your journey and selecting the best ones for you, right?
Absolutely.
Nice. All right, let's get into our second segment, deep
Okay.
dive. In this segment, we get into the details about specific technologies, implications for everyday people. We're going to talk about artificial intelligence and healthcare. So, at the top of the show, I mentioned that you were invited to participate in the first digital health startup day hosted by the Consumer Technology Association. So, tell us first about who was there and what was the purpose of this event.
Yes. So the purpose of the event was um, to support CTA's new initiative in the digital health space. So they already work with a lot of technology companies who play in the digital health space, and then some who are just firmly in the digital health space, but they're the larger big boys, if you will, that we all know.
Mhm.
And this was more about looking at innovation for the future startup companies that will, in their eyes, transform how we look at digital health and AI and all those different types of things. So that was their effort to bring us together, to meet each other, and then also to, I guess, if you will, prepare policy points, and then meet with different legislators and or their staff, primarily from the health committees in both chambers. So that's the Senate and the House.
Okay. Any politicians we would recognize that people would recognize?
Probably, yes. There
You
were.
can't share though?
There were.
Okay. Well, that's awesome and congratulations for you. So, when you talk big players, are you talking about big players like Google because they have Fitbit and Apple with Apple Health? Or are you also talking about, I know Siemens has a lot of medical devices in the hospiters. So
You're
both
spot
of all
on,
of those?
including Microsoft as well. You have Amazon. You have Hers, Hims, those
Mhm.
types of companies as well.
Okay.
Mhm.
Wow, I'm impressed. Hers and Hims made it into the list there. I guess I'm not in that with Hims at least. I'm not following
Yeah.
them as much as
So So you have to think of it as they're technology companies, but CTA is consumer. So any type of company that is
Mm,
consumer facing. So I
mhm.
guess you'll call like direct to consumer healthcare.
Got
Like
it.
those are
Okay, so not the hospital
that,
equipment
but actually
user.
belong to the organization. Mhm.
Got it. Okay. All right. All right. So let's go through the three main points that you shared on LinkedIn. And I'll make sure that that LinkedIn post is linked in the show notes. So, one, AI may be on its way to our doctor's offices, but it's not ready to see patients without a physician's guidance. And it will not replace physicians, but will just change how they practice. So, can you tell me more?
So everyone loves to talk about AI, like the power of AI. And it truly is a powerful tool, but there's layers to it. Like one, there's an aspect of data collection, right? And data management, and then how you use that to train your algorithms. And then the
Mm-hmm.
second part is I truly believe AI in other industries can operate on its own. So if we're talking like marketing, advertising, absolutely product recommendation without a doubt. But when it's healthcare, there's so many different moving pieces to it. And because if you have the same disease as, say, your cousin or your best friend, it can still present very differently in you. So you're going to need a little bit more personalized attention, and AI just can't do that,
It's not
right?
ready. Yeah.
It's not ready. And then when you add in health equity to that, it's really not ready, right? Because now we're going to data sources that are biased in and of themselves. So then when we
Right.
start training our models on that bias, then you start to widen these gaps of health and equities. So
Right.
that's why it's not ready just to be unleashed. And then in terms of it will be an aid, meaning that you will have different settings where physicians are using AI. It will be in a hospital, it will be in an operating room, pre-op, maybe. I could think of
Mhm.
different places. The triage that I talked about before, right? So now these systems, in some cases, will be providing point of care recommendations. You
Mhm.
know, so the doctor doesn't have to, hold on, wait 2 hours while I go call a colleague in Washington because they're a specialist in brain surgery, right? So
Mhm.
like those are types of things that they'll be able to aid, or maybe I want to say like 5 years from now, maybe 20, 30 years from now, you may be seeing some different robotics doing like low level, like say for example, you talked about you had a biopsy. Maybe a,
Mhm.
a machine can do a biopsy and not leave that pretty little scar that
Yeah.
you
Yeah, this is so fascinating because there's a bunch of issues that you touched on. I mean, one, our medical body of medical research without artificial intelligence is inherently biased because of all of whom was selected to participate, whether it was favoring uh, white people, which is yes, in general, most studies favored white people, and then most studies also favored white men and
had.
excluded women because they didn't want our hormones to get in the way of their outcomes, which is funny because we have hormones and we have to account for those in our treatment. So, talked about it on Make Sense before about, garbage in, garbage out, like the data you put into a database, you put into an algorithm, you train your AI on. If it's garbage and biased already, then your algorithm is going to be garbage and biased in what it produces. So, uh, yes, we have a long way to go in collecting more fair and equitable data to train these algorithms on. So, yeah, it can't. It would be unfathomable to unleash AI without those equitable data sets. Um, I think about also in a previous Make Sense, I spoke with a pediatrician, Jinsey Jacob, and
Mhm.
she works in the emergency room, And she just kept pointing to, she's also an angel investor, she just kept pointing to like everything that gets deployed in a hospital has to be covered by insurance. So there's like regulation and there's insurance, and if you can't get past those two,
Mm-hmm.
then the technology is not going to make it into the hospital, let alone the bureaucracy of going through hospital administration. So
Exactly.
we're just going to see the application of AI go a lot slower because of those barriers.
Absolutely.
Yeah. Um, there was one more thing I wanted to hit on, but I am forgetting it right now. The one or two places that I thought AI could help with in for doctors sooner rather than later is like one, patient notes, like recording patient notes. Doctors spend so much time updating electronic medical records just for the sake of billing and for covering their butts and also making sure the notes are there
Mm-hmm.
for the next time. AI could help like prompt to fill those patient notes out faster. I think that would be incredibly helpful. I also heard about doctors using ChatGPT to help them make their emails and instructions more empathetic, which I also thought was a nice potential application for doctors that are self-aware enough to know that they're not coming across as very kind. So
That's interesting because I mean that's like that opens up another debate, right? Like that opens the debate of should we be delivering bad news by email,
Mhm.
right?
Yeah,
Like
yeah. And should we be trying to train our doctors to be more human as part of their training and not leave it to a robot to um,
exactly because
to compensate,
yeah,
right? Yeah.
yeah, interesting.
I think one thing I want to also hit on with that point is that use your brain, right? With any AI tools, you still want to use your brain. And so, really, if we jump 3 or 4 years ahead in certain, or even another year ahead, like you pointed out, giving suggestions of what the course of treatment could be, like we still want the doctors to be a layer there to use their brains and their knowledge because they need to personalize it. And the AI is not mature enough, which now I remember my point.
Yeah.
Yeah, go.
So it's also a thing about there still is still the power of the human element, right? And so there's just something that we have innately as humans. So even an AI may suggest something or want to go down a particular course, right? But the doctor, say there's a doctor who has 30 years of experience and who has seen this over and over and over, like there may be something that clicks in them that's going to say, okay, we're going to run these two tests in addition to the standard test. This is saying because this is
Mhm.
standard protocol that everyone else has done, but maybe I'm in West Virginia and there's something just really particular that I know about this patient population that's not going to be covered, right? So
Yeah.
I think, like you said, like you're using your brain and we still have to capture that. I just don't think there's ever going to be a way that AI is going to capture our innate human
Not
abilities.
not unless we convince doctors to start sitting down to train algorithms, but that's not going to happen. They have
I
better
don't
things
think
to
that's
do.
going to
You know,
happen.
the thing the thing I remember now is that someone explained to me that where AI is right now is that it's like a child. It's certainly capable of doing certain things, like you said, advertising, marketing. I still think people want to use their brains when they're looking at marketing copy and product descriptions that they're creating. But, what a child can do is very different than what a doctor can do. And the child has not gone to medical school just yet.
Right,
Right.
exactly.
Cool.
Even still, even if we are an adult, I still haven't gone to medical school, right? So like
Yeah.
there's gonna be a lot of things I don't know. I mean, I could do my own home remedies, but from my great grandmother or my grandmother, but I don't know if those are actually going,
Mhm.
gonna work. So
They may not work, right? All right. So the second point from that digital health startup day was kind of unsure how GPT chat will truly work in healthcare, given we don't know where this information is coming from. There isn't a sense of quality control, and some medical resources, as we just mentioned, are biased and left unchecked will deepen the health equity gap when used. So, is there anything we haven't covered there yet in the uncertainty around, ChatGPT or?
yeah, the only thing I will add to that is that comment was taken from a comment from a representative from the FDA. And so they're really looking at, of course, AI, but also GPT chat, as well as some of the points you said before about getting the regulatory sign off to even have these tools. And so one of their concerns, which I think we're going to get to in one of the trends topics, is that we don't know where this data is coming from. We have no clue, right? And not just in terms of it being, biased, but did you get it legally? Like where did this come from? Can you provide us with the references, things of that nature? And even still, FDA is still going to want to heavily regulate how it's actually applied.
Yeah.
So the verdict
Yeah.
is still out.
Yeah, it made me think that I would love to have a chat interface with an algorithm, an AI that has only read academic papers, and I'd love to see what that AI gives me as responses as it compared to the responses that ChatGPT, which has been trained on, we don't really know, but everything
Yeah,
available, and
exactly.
how those answers would differ.
Yeah, but
Yeah.
I definitely think the end result of a GPT chat is awesome. It's just about
Mhm.
where do we get all the information from?
Yeah, yeah. So, okay, third one, a little away from the AI piece, but it's a topic I love talking about as well, is focusing on interoperability and then also health equity, access, privacy, data, decentralized clinical trials, and real world evidence. That's a lot in there.
Yeah.
Interoperability is like one thing. I mean, there's like two or three main electronic medical record companies, and they are dragging their feet on doing any kind of data interoperability or standards. That's their competitive advantage or their barrier to entry for any competitors. Health equity, decentralized clinical trials, real world evidence. That's
Mhm.
a tell me more.
Yeah,
You know
it
more
is.
than I do.
And it's all, I would say it's all connected at some point,
Okay, tell
right?
me
But
why. Tell me how. Yeah.
because it's so interesting. So you talk about, the big players in the space who don't want to give up their competitive advantage, right? For their EMRs and their EHRs. But what's interesting is that you're going to have a lot of digital health companies who are setting up their own systems, right? Even if they're white labeling, so then they're going to start contacting and connecting with each other. And then that's what's really going to happen is you're going to have patients who are going to really drive this because we're at the point where we're tired of saying, why do I have to keep my medical files in my trunk and then every time bring them into every doctor that I go to? You all should just be able to communicate together, right? But then when we talk about patient notes, then that's where you can get biases as well, depending on how a particular doctor wants to talk about a patient group, right? So that's what we use to train AI models, right? So then now we have the health equity gaps. And then you talk about data sharing and data privacy, like how much, does a digital company, a technology company want to share with their patients, right? If you read the privacy statement, they'll say blanket statements like we will use de-identified data, you know, as best as we deem appropriate, right? To
Mhm.
build out our platform. So it's like, okay, I get it, right? But then it's like the third party aspect. Who are you sharing this with? How are they using it? But on the flip side is if I am sharing it with a pharmaceutical company who wants to have a more open clinical trial, but they have problems with recruitment, and I have a patient population that trusts me, that's like, oh yeah, like we'll do this, right? So then again, like it's all like a big circle. It's just
Mhm.
one big happy family. We all need to figure out how to make them happy. We're all in therapy, right? And
It's
then
like
we
a
find
normal
therapy.
family. It's a normal family. You got
It's so
issues,
normal. We're
aunts and
all
uncles
going to
that
group
don't talk to each
therapy.
other.
Exactly. And
Right?
exactly. So it's like different pieces of the puzzle.
Yeah, I appreciate you bringing up the patient notes and the biases because I mentioned that other guest I had, Kat Hoffman, who shared that she had gone in to a hospital and actually a hospital that had funded her startup with like the first $10,000 in investment. She had gone in for neck pain, and a year later, she had neck pain again, and she wanted to look at the
Mhm.
patient notes to figure out what the advice was and whether she should go back to see that same doctor. And she she would be fine if I said this. She presents as a lesbian. She's got short hair. She likes button down shirts, khakis, whatever. And she looked at the notes, and the doctor had wrote in all cap letters transvestitism, which one, neither of us knew the word. She had to look it up.
Right. Okay.
It actually means like someone that is turned on by dressing in the opposite sex. And it has absolutely nothing to do with her neck pain. And it was nothing that was brought up at all in her patient notes.
Yeah.
So this is just to accentuate to the audience that um, these notes are biased, right? And sometimes they have nothing to do with the condition. The next thing
At
you
all.
know, another neck pain doctor could be searching for some issue, and the AI bot is recommending, something to do with, gender identity or sexual orientation. And so if you have too much of those biases, you're going to get really crap advice from the machines that we're training, right?
Absolutely.
Yeah.
Absolutely.
Are you talking about on the, decentralized clinical trials and health equity? Are you talking about, there's a lot of startups uh, that are focused on specific issues or specific categories. And so, for instance, there might be a dermatology trial and they're having a hard time finding
Mhm.
women
Mhm.
of color. So they might engage with you. And then
Mhm.
we know you're going to do an upstanding HIPAA compliant job because you are an upstanding entrepreneur and founder. But there might be other tech startups that excel in some niche, and maybe they're not doing what they need to do to share information about patients so they can do the recruiting. Is that what you're talking about?
Yeah. So yes and no. So um you actually hit on a truth point. So we started to have a lot of like pharmaceutical companies, wellness companies, those that do, your typical wellness products that you might find, like, or supplements, some types of hair or skin or other types of supplements. We even had consumer brands reaching out to us because they know that they need to be better with their trial participant populations. And so they reach out to us, how can you help us, right? And so we try to figure out a way to help them. um so it's less, a more, how do I want to say this, I don't want to call anybody like not unethical, but I think the best way to proceed is to say we can help you with recruitment for your trial. We're not going to sell the contact information or the data that we've already had for our patients to help you. Just know that we know that if you come to us to help you, we can help you, right? We can talk about who you are as a company, why you're doing this, why our community should consider signing up for your trial. And then if they want to, they can. If they don't, they don't, right? Like,
Right.
I think
But make it the
that's the best
choice.
way to do it versus just saying, oh, like we have all this data, which is great. Then we're just going to sell it off and make millions and millions of dollars or
Right.
trillions of dollars, actually, because it's probably worth a lot.
Yeah. Okay. So really the best way to do it is if a company comes to you, medical or consumer, you know,
Mm-hmm.
the if you're using a technology product and you're sharing your data, that company should ask you if you want your data to be part of a trial, or if you want to sign up for the trial and supply fresh data directly to that whoever's running that trial.
Exactly. And I think it also has to be already part of your company's DNA to want to do that, right? Like I don't think it's something that you can just turn on and not really have an easy, or I would say relatable connector, right? It can't be so far off where you're like, okay, so I was on a mommy and me app where we're doing, prenatal care, postnatal care tracking, and then all of a sudden you're asking me for something that has to do with foot care. I'm going to be
Yeah.
really like, okay,
Yeah.
that doesn't necessarily tie together, right? And it should be like a part of this is what we do so that the community already knows and is already bought into your concept of, yes, you're caring for me, but you're also advocating for me as well.
Yeah, and you're giving me opportunities to participate in the advancement of this area that I am already thoughtfully
Exactly.
interested in. Right.
Exactly.
Cool. Awesome. All right. That sounds like a wonderful day. Is it still sitting with you now? Were there takeaways that you, besides these points, like, is
Mhm.
there stuff that directly kind of impacted the way what you're doing with Kept Health or how you're thinking about the rest of 2023?
Yeah. So one thing I didn't talk about, which probably a lot of folks in healthcare probably will push back on me on, is the way we pay for healthcare and insurance. I really think a lot of the business models that we employ needs to change, right? Like it just needs to change. Like, everybody can't afford insurance or everybody doesn't have top of the line gold standard insurance. And a lot of the companies that are being created today are tailored towards, individuals who are on the upper,
Yeah, who can
income,
afford to private pay for things.
private pay, or even you have some digital health apps or like, okay, come to us and we'll help you track all, this information. It's only $125 a month. And you're like, oh, that's great. Okay, that's kind
Only?
of expensive. But guess what? I still have my insurance that I pay monthly. Then I have a deductible on top of that. And then I have anything that I have to pay for. And so it's like we have these great ideas, but the business models don't necessarily allow us to really do what we say that we're doing.
Well, going through, I sit on the board of a Femtech startup as an advisor, and it's fairly straightforward to get a physical product covered by FSA, HSA, but the investment to go through FDA trials so that you can get insurance to cover your startup as an actual treatment is a whole nother story.
Mm-hmm.
And our, venture capital, our private funders, there's not so many of them that are willing to fund startups to go through those trials. And so I wonder, did it come up at all with like you mentioned government, FDA, whereas at the event, does it come up at all? Is like, how do we like, how do we get more of these, maybe covered by insurance, subsidized or anything so it can serve more people? Or how do we
Um,
fast track this a little more?
so it's insurance is so complicated, right?
It's so
So
complicated. It was one of
even
my
when
first full-time jobs, I know.
yeah. And for myself, I spent like 20 years as a healthcare lobbyist, right? So it's until you change how health insurance companies run and how they love to make money, right? It's not gonna trickle down or be the responsibility for us to change that, right? So it's those companies and the FDA, and then you have CMS, right, which is still a type of health insurance company, right? So yeah, like that's how it's gonna have to change. You're gonna have to like break that up somehow. And then also from there, I think the next step is to not have insurance tied to your employer. So that's gonna
Yeah.
force different business models, different strategies. Um, but yeah, so full disclosure, this is why we don't take insurance. Just to be,
Right.
and this
It's
is why a lot of
complicated.
dermatologists do not take insurance. So yeah, it's extremely complicated. And then it's just, to me, a lot of times insurance is, how do I want to say it, where it's a double-edged sword. Like you need it because these
Yeah.
costs are like balloon so much. Like you get a bill, you're like $200,000 for an aspirin. Like
Yeah.
how can I pay that, right? Like
Right.
that's insane. But then at the same time, it's like, it doesn't need to be that expensive, or I
Mm-mm.
have to fight with you to cover it, right? Because you're saying, oh, you didn't fill out this form right, or last 6 months you did this, so now you don't get that. It's just all that needs to change, and then it'll be a lot easier for entrepreneurs and investors to like wrap their heads around the space.
100%. I think I could do a whole make sense episode on the bureaucratic and technological and economic mess behind health insurance
Yeah,
companies. Um, yeah, the data. Oh, it's just awful. So I will not go down that road. Um, but that is why universal healthcare and other kind of like let's nuke the system and start over ideas keep getting thrown out there, is
yeah,
because of how big of like a rubber band knot ball medical insurance, hospital systems, all of it, government, all of it is around that. All right, let's go into our last segment, Sheena.
I'm ready.
Last segment is what do you know? So, this is where us relatively intelligent tech ecosystem insiders discuss a hot mess that's made national news. We don't claim to be experts, but we certainly probably know more than you do. So, Sheena, the comedian Sarah Silverman has joined two other authors in a class action lawsuit against OpenAI, the company behind popular AI tools like ChatGPT and Dall-E. What do you know?
That I knew it was gonna happen. I
Yeah,
knew that was gonna happen.
yeah.
Right? Like you just knew it was gonna happen because they would never say anything about how it was like
Citations.
built. Yeah, it was just like this is what we're doing, and this is who worked on it, this who funded it. So I would say be leery of big things that come out with a splash that promise the world, right? Because something just isn't right. Maybe I'm just too
No, no.
cynical.
I mean, there's for sure, from day one, I was like, can you give me some citations with what you just shared with me? Like, even if it's just like, here are like five links that are most relevant to this body of text that you just gave me in ChatGPT,
Yeah,
right?
I was like, how do they know all that? Like, where are they getting this from? Are they
Yeah.
just like taking it from Google and then, but once you sent me that link, I did some more research. And so apparently there are sites that have all these books and chapters. Some are like even on the dark web. And this is where you can go and, I'm not, so they say this is where people can go. They went to get this information. So it's going to be
Yeah.
interesting to see how that plays out.
Yeah, so for those of you that don't know, the specific suit with Sarah Silverman and the two authors is that you can go into ChatGPT and uh, ask the program to provide a summary of Sarah Silverman's book, and it will provide a very healthy, detailed summary of her book which could be part of fair use if copyright management information and citations were included, or a link to where they can purchase the full product were included. You know, there's potential to rectify this, but essentially, ChatGPT and some other sources, including, I believe, Meta's, they have a large language model that they have built also, have been trained on shadow libraries, as Sheena had said. I think one of the names is Bibliotic. Did you
Yeah.
catch up on that name? Yeah.
Hmm.
I think Meta, I have this note down. Meta used data sets from a company called Eleuther AI. I have no idea who they are. And they used this bibliothèque, which is, I think, under its own copyright lawsuits, right? Like they have all this content of books that they should not have, that the authors are not getting paid for, and people are being able to access. So essentially, if you were a late 90s, early 2000s kid and you used Napster,
Hmm.
this is a similar lawsuit, right? Like it's in the same category, right? Same with torrents and BitTorrent, right? And that BitTorrent got kind of taken down as well because they are providing content that is not theirs, and the original creators are not getting paid for it.
Yeah, and I think a part of it also, the lawsuit and just questions in general, is that a lot of times these programs will actually have large excerpts of like big sections from the book, right? So it's
Right.
like, okay, if that's a little bit too much, it's not like two sentences, it's like a page of the full text in there. So they're like, where are you getting this from? And then on another thing, E. Luther, that name just sounds a little like dark.
It doesn't sound like Lex Luthor. Like
That's
it
what I
sounds
was
like an
thinking.
evil
I think
person.
that's where they got it from, Lex Luthor. I know that's where they got it.
So
Alleged, I would say.
So another company I have, again, it's Stable Diffusion. They're a generative AI company, so they with prompts will generate images for users. And Getty is suing them because they believe that Stable Diffusion was trained on Getty's data set too. Is there, you have to get data for kept health, like it, what would these companies have to do to rectify the situation? And besides like coming up with some crazy points that help them win the lawsuit aside, like if they were to do everything above board,
It-
what would that look like?
So to get the mass depth of content that they have, images that we're talking about, the best thing would have been to go to Getty Images in the beginning and
Mhm.
say, hey, we took, let's say, 1,000 of your images that we scraped from your sources, and this is what we were able to do with your images. How can we work together? Can we have a partnership? How do we have access to your images to build upon? But the thing is no one wants to share, right? Because then you just have to share.
Well, because Getty's response would either be like, pay us billions of dollars for, pay us the $500 per image, or we will buy you for something very little.
Exactly.
Maybe the 2.5 million that your investors gave you to build this product in the first
Yeah,
place.
and then they will
And
also say we've been collecting these images for
hundreds of
years,
years.
right?
They've spent
So
hundreds of millions
exactly,
of dollars acquiring
exactly.
these images.
So you have to try to, find a balance. And you did mention like we collect data. So there are open source dermatology skin databases that
Okay.
we use, but the majority of those are non-skin of color, right? So we're
Right.
able to go there. Wonderful, get that. So in terms of data collection over on the other side, like we have to go direct to the consumer, or we have the foreign partnerships, like we just formed a partnership that I'm looking forward to announcing with a major university, right? So like that's how we're able to like build out our images. It's really grassroots and starting, from
Hmm.
scratch and getting people to believe in our mission, not just how we provide them great care.
Yeah. Yeah. So let's talk about data for a second because, training these AI algorithms, like you need massive amounts of data. And the differentiation between one chat tool and another, or, one generative AI tool or another, um, differentiation is the data set that they have. So are we basically saying that these companies that are getting sued basically they stole their data so they have an unfair advantage on the marketplace?
I would say I'm allegedly based on the data.
Allegedly, you're right. You're
I
right.
don't
They
watch
haven't.
YouTube, breakdown shows, so we always have to say allegedly.
Allegedly, you're right. You're
So,
right. You're
um, oh man, that's so interesting. Like, did they still like? I wouldn't say they stole the data. I mean, you can make that argument, but
They overlooked
what
it.
makes their what? How can I want to say this? If everyone's going to the same lake to get the same data, we're not that different.
Hmm.
So what's going to make us different is who gets it faster and then who gets it out into the market the fastest and the prettiest, most pristine way, right?
Hmm.
So that's the issue, right? If everybody didn't have these tools and everybody had to figure out a way to get it themselves, then there would be more creative ways that we would develop that would make us different because we're really not different.
Hmm.
We all have the same information. We're all doing the same thing. It's just like we have to be faster and better than our
Right.
competitors.
Right. The differentiation almost in any business is, the ability to connect with your customers, solve a problem that they want solved, and to like galvanize people and partners around you, right? And so the data is gold, and the data can be the differentiation, but let's make sure that we're getting it through fair use, which is a copyright terminology, right? So
Exactly. Exactly.
I was reading back when I was in graduate school at UC Berkeley back in 2006, 7, there's so many different um, libraries were coming online, and there were lots of copyright conversations, and there were, particularly for this one legal professor, Pam Samuelson, that I got to know while I was at UC Berkeley, talking about who has access to academic papers, who owns them, is it the publications, like how can we share that data? There are potentially some ways that these companies could get around it, could win these cases, if they can prove that they're fostering public interest by providing access, or that one example I thought was interesting, and I think I may be geeked out on this copyright too much, Sheena, is that back in the day when Sony introduced Betamax,
Mhm.
Universal sued Sony because people were using Betamax to pirate, movies and
Movie.
television.
Yeah.
And the Supreme Court kind of favored Sony's side because the majority of the use of Betamax was for people to record their TV shows and movies and use those privately, right? So ChatGPT would have to prove that like most of the usage is for infringing use
Right.
cases.
For personal use. But
Yeah,
then that wouldn't be very appealing for a company that wants to be $1 billion company, right?
right, right. And then at the end of the day, they'd still have to comply with fair use, which requires citations. And I think the only claim I've heard is that when you train AI on a huge data set, it's very hard to connect the output to specific citations. Is that true?
So I don't know too much about, citations, but I would say it is very hard to make the connections, right? And so I think it's because AI is supposed to be like a functioning brain. And from what I'm gathering with GPT chat, is that that's what it wants to be. It wants to be like another brain, not another resource library, right? Because then the question becomes, well, if you're giving me this information and you have like 20 references, then what makes you different than a library resource that I just went and downloaded a paper and
Right.
I read all the resources, then I went back in. So I think, I don't know, it's interesting. So
Well, yeah. So we'll see if the lawyers and legal professionals that are looking at all this are smart enough and technologically advanced enough themselves to rule uh, whichever way in a very informed way, right? However they
yeah,
rule, whatever the outcomes are. Hopefully they're not informed, and they are informed, and we think about the impact it has to future possibilities and all companies that are, you know, engaging in this work, including Kept Health, right?
absolutely.
Yeah. So let's make it make sense. We've had
Okay.
a great conversation with Sheena Franklin, founder of Kept Health. I would say artificial intelligence is a child without a medical degree. So that child is not ready to serve you independently and autonomously in healthcare settings. But there are some ways that it is starting to help, and we will see that continue to evolve in the coming years. Is that fair to say?
That's spot on.
Cool. So thank you for listening to Make Sense with me, your host, Lindsay Tabus, and guest, Sheena Franklin. We hope you enjoyed our take on healthcare AI and also these recent lawsuits. Sheena, where can people find you online?
You can find us at kept.health. That's our website, clean and simple. And then also on Instagram at kept health.
And is there an app that we can download?
Not yet. It will
Okay.
be out and ready in October.
Cool. Awesome. Well, we'll look forward to that. So, as always, for those of you listening, you can check out all the links and resources in the show notes. Final note, if you want to continue to be the smartest person in the room, make sure you're getting notified when each episode hits. On YouTube, hit that subscribe for next week's episodes and follow wherever you get your podcasts. Thank you, Sheena, for joining me.
Thank you for having me.